Hi everyone, I'm Dr. Emily and I'm going to talk today a little bit about physical therapy and neck pain. So let's talk about first the source tissues that could be causing that pain in the neck region. So it could be coming from your spine. You could be having a hypo or hypermobile movement in there. So hypomobile would be your vertebrae, your spine just isn't moving well enough, or hypermobile, which could be coming from like a whiplash injury. Your spine is just a little unstable and it's moving too much. Or another source tissue is muscles. So muscles, ligaments, tendon. So when our muscles are too tight or too loose, they're going to be causing different pulls on our neck. So a lot of this is coming today with being on our phone so much and being on working computer jobs. So your head is a little bit more forward and down. So every inch that you're putting your head more forward, it's increasing the stressors on your actual joint, causing more pain, more discomfort. So there's a few things that through physical therapy that we will do. First, we'll look at your posture. So like I said, with today's age that we're more rounded in our shoulders and just putting that increased stress. So you're causing your muscles to be more tight and others to be looser, which we like to call upper cross syndrome. So one thing we'll do is look at your posture, try to get you more in a perfect upright posture. That's going to help correct your normal cervical curve. And then we'll also look at muscle strength and mobility. So through physical therapy, we can do manual work that's going to help actually increase how well your spine is moving. And then also add some therapeutic exercises that will help the muscles be stronger, the ones that need to be, and the other ones that if are hypertonic to be just lengthen a little bit more. So those are a few things that physical therapy will do to help with your neck pain. If you have any comments or questions, you can comment below or give our office a call. Thanks.